Okay, so for my medical report assignment, I did an SBAR report, so situation, background, assessment, and recommendation. And I did it as if I'm a nurse in the emergency department doing a handoff report for a patient that's going to be admitted to the med-surg unit. And I'm doing this report to another nurse. So my name is Abby, and I'm a nurse down in the emergency department, and I'm calling to do a handoff report for a patient headed up to your unit. This patient's name is Jane Doe, and she's an 18-year-old female who was admitted this morning around 9 a.m. for severe pain when urinating and radiating flank pain. Jane has a history of urinary tract infections in the past and reports not being fully compliant in taking her prescribed antibiotics. She states the burning sensation when she uses the restroom started 3 days ago and has gotten significantly worse since, with the pain now radiating up towards her lower back. She drinks and smokes socially, has no known drug allergies, and has no major family medical history that she is aware of. Upon my initial assessment, lung sounds were clear bilaterally, and no adventitious heart sounds were heard. Patient reports her pain is at an 8 on a 0 to 10 scale. The flank area of her back was sensitive to palpitation, and her skin was warm to the touch. A urine sample was collected for a culture and urinalysis, along with a CBC blood draw, which showed an extremely elevated white blood cell count, leading to the diagnosis of a urinary tract infection. She's currently on intravenous fluids to keep her hydrated, but her urine output has not increased. Capillary refill is less than 2 seconds bilaterally, and no edema is currently present. Her last set of vitals were collected about 30 minutes ago and are as follows: heart rate 77, blood pressure 122/80, respiratory rate 20, O2 saturation 98 on room air, and temperature 102.1 degrees Fahrenheit. I'd recommend starting her on a strong regimen of oral antibiotics and maintaining the patient in a semi-Fowler's position since her urinary output hasn't increased with at the same time of her being on IV fluids. Pain medication should also be started as soon as possible because this patient is quite uncomfortable. A CT scan of the abdomen has been ordered, and those results should be reviewed soon to rule out any possible kidney infection or irritation. Fluid input and output should be monitored closely for the duration of her hospitalization as well. And strong patient teaching should be implemented to stress the importance of medication compliance before her discharge. If you have any questions, you can let us know.